do you think the cancer rates have gone up in the last decade?
Absolutely, pal. What I see is the cancer doubling time is coming down. Previously, the incidence of cancer, which doubles, we call it as doubling time, incidence doubling time, is about 20
So,
years.
what is doubling time, sir?
Doubling is cancer incident doubles itself.
Ah,
Say 5 percentage of cancer becomes 10
10%.
percentage. For
Ah,
that to double, it takes about 20 years.
huh.
Any cancer, lung cancer, breast cancer, stomach cancers, it doubles up in a reasonable over a long period of time. But what happens now is that cancer incidence doubling time has drastically reduced. Previously it's about 20 years, now it's less than 10 years. That means every 10 years you see double the amount of cancer patients in each cancer, whether it is stomach cancer or any other cancer. So that's a very worrying trend.
Mm.
And I can say we, as at least from Indian point of view, I can say that we have moved from communicable disease predominant public to non-communicable disease like hypertension, diabetes, and the cancer.
So, you are a pancreatic cancer specialist as well. As a matter of fact, you are my senior in PhD Medical College, and I'm so proud to have you as my senior because you are one of the surgeons who actually do laparoscopic complex procedure called Whipple, where you remove majority of the pancreas organs and surrounding it. Mm, do you think obesity increases the risk of pancreatic cancer?
Yes, obesity has negative influence on majority of the cancers of the
Mm.
abdomen,
Mm. Mm.
starting from stomach on to pancreas, liver. See, fatty liver, from obesity to fatty liver to cirrhosis and then cancer. It's a common pathway. The one common, I would say, the axis of evil is obesity.
So, you,
There are multiple axes of evils as far as the cancer causing agents, like smoking,
mm.
drinking. Previously, you used to have somebody smokes, somebody has drinks, they're bound to have cancer, isn't it?
Mm.
Now, definitely we can add to that evil obesity as well, without any doubt.
So tell me an example where obesity could have been caused the liver cancer in your experience.
Oh, yes. See, previously, when we talk about liver failure, I'm a liver, HPB, liver pancreas
Correct.
specialist.
So in your experience, educate the audience, a patient that you might have seen where a liver cancer might have come unexpectedly.
See, that's why in liver cancer, 75 and 80 up to 80 percentage of liver cancer happens in a cirrhotic background, meaning liver would have shrunken because of various factors, and then the tumor pops out because the entire liver is carcinogenic. There are a lot of nodules which can turn into cancer. Previously, it's all about hepatitis and alcohol, which was the main cause for cirrhosis. Having said, now I can add along with the alcohol and the hepatitis B and C, obesity as an important causative agent for cirrhosis.
Mm.
Previously, it's very rare.
Mm.
Now, cirrhosis, yes, somebody I have to think whether is not only alcoholic, not only a hepatitis carrier, but also an obesity.
Mm.
So, obesity up to 20-30% of the cirrhosis now in some countries are because of obesity. It starts with NASH, it starts with fatty liver, liver swells up initially, and you have seen fatty liver. We have conducted very big population studies, and Dr. Pal, you will be startling to know up to 60 percentage of public are suffering from fatty liver.
Wow, more than one and two.
Oh, yes.
Wow.
So that's a very mind-boggling statistics. Not all, I meant to say, not all will have cirrhosis, but
Mm.
quite a good amount of percentage. Imagine numbers, in sheer numbers, crores of people are having fatty liver. Even few percentage turning into cirrhosis is a big thing. And then in that cirrhosis, whether it is from alcohol background or hepatitis background or from obesity background, it doesn't make any difference. The cancers.
Educate the audience what is cirrhosis.
Okay. So cirrhosis is the end stage liver failure.
Mm.
Initially, the liver swells up. We call it as fatty liver. Then it loses its function, and then it shrinks in size. That's the point all irreversible damage occurs. So as it progresses, it shrinks further and further, so that at that point, the cancer pops out. Cirrhosis is the end stage of all liver failure, whether it is fatty liver, obesity, hepatitis,
Alcohol.
or alcohol. So it doesn't differentiate. So obviously, we are in a common pool where you are bound to have liver cancer. Treating liver cancer in a shrunken liver is very challenging than in a normal liver. So I can knock off 60-70 percentage of liver without any problem.
Can you educate what do you mean by knockoff?
Okay, if somebody has a liver cancer, and if I want to remove 60% of the liver from our body, still 30 to 35% of the liver which we leave behind is quite good enough for us to grow. In about 2.5-3 months time, it grows. That's the basic for all the liver transplant, when we take out half of the liver from a normal person and then give it to the needy. But in a cirrhotic background, that means when the liver is shrunken and then done and outdated, even removing 20 percentage, not even I leave alone 20, even 5 to 10 percentage if you liver, the patients cannot cope up, because already they are not coping up with the entire liver. Even you just pinch a small bit of liver, still it hurts us. So that's the regenerating capacity. In a normal liver, you can afford to lose 2/3 of the liver. In a shrunken liver, in a damaged liver, even pinching of a liver tissue will harm you. That's where the liver cancer treatment becomes difficult.
You open up the abdomen on many patients, or you do laparoscopic. How does a liver look in a fatty liver?
It's a difference between a good looking angel and a very scary demon. A smooth, sharp edge liver is a normal healthy liver. Very rough, shrunken, lot of undulations. You see small dots on it. It's all very rough. That's a shrunken liver. It's for us. You all know. You also would have seen. It's not a very pleasant feeling even for doctors because of shrunken liver. So it's a smooth, sharp edges, good one. Very rough with blunt edges, that's a bad liver.
It's bad. So the point here is that fatty liver, please take care of yourself, because obesity, if you can control it, you can prevent it from progressing to cirrhosis.